A common refrain among Bernie Sanders voters is that single-payer healthcare or free healthcare is their single issue, and that they just want healthcare like the rest of the world has. Sanders' proposed program is called Medicare For All, which promises to be absolutely free at point of service, with no premiums and including full coverage for all medical services, including dental, optometry, and prescription drugs. This has very little to do with the existing Medicare program in the US, which is more of a government-backed insurance regime for retirees, which funds itself largely with premiums and copays from patients. The closest existing cousin would be Medicaid, a means-tested welfare program which Obama's signature Affordable Care Act was an attempt to expand. Sanders' Medicare for All is often referred to as single-payer healthcare, which it technically is, because there is only a single government organization funding treatment in the entire country. Other countries which fall under this label would include Canada, Japan, Sweden, and the UK. Note that this does not include many countries like Germany, which still substantially outperform the US on healthcare metrics. Many countries employ a multi-payer or two-tiered healthcare system, which is structurally similar to that of the US, where there are public options for insurance or care, such as Medicaid, competing with private providers. The difference, and it is a substantial one, is one of scale or scope rather than kind, with the public programs being better funded and more muscular than Medicaid and Medicare are in the US. If you want to list countries which have a healthcare system at all comparable to the Medicare for All proposal, your list of comparisons shrinks even more. At a structural level, the single payer in many countries takes the form of a social insurance, similar to Medicare, which demands copays or premiums. Japan and France would be prime examples of this. Providing total coverage of all health-related services, including dentistry, is quite rare, and no countries actually ban private health insurance like Bernie Sanders is proposing, with many countries such as South Korea, Canada, and Japan featuring large portions of the population using private or employer health insurance despite the existence of a powerful government service. And, despite a huge variation in organizations, all of these systems work well, at least well enough to provide better outcomes than the US does at lower costs. A fair, humane system for universal healthcare can obviously be built with a multi-payer framework like what many of the Democratic candidates have been proposing, because it's actually the same system that most of the developed world uses. It's also probably more realistic. Even if we assume that the government can reduce the cost of healthcare and thus the overall spending on healthcare across the US economy, and we forget about every other big policy proposal, Medicare for All would entail increasing the federal budget by over $1 trillion annually, when current tax revenues are only $3.4 trillion. Before you ask, that's a lot more than the entire military budget, and the total wealth of all US billionaires adds up to a little under $10 trillion. America is a rich nation, so there are sustainable ways to collect huge amounts of money, but they probably entail across-the-board tax increases that include the middle and working class, matching the higher and less progressive tax rates that you see all across Europe. There is no magic money tree from which infinite funding can be painlessly extracted. The incidence of payroll or corporate taxes is almost entirely on workers or consumers. If you think that tax increases are something that American voters will swallow easily, you have never paid attention to American politics. To the credit of the junior senator from Vermont, he will admit this when pressed, claiming that the effect of the large payroll tax increases would be offset by the elimination of insurance premiums and copays for workers. But that probably still means a serious uphill political struggle, because any polls on the popularity of Medicare for All are very abstract and don't usually have questions that reflect the increases of taxes or the banning of private insurance that would accompany the actual plan. For one reason or another, most people poll as being very happy with their employer-provided health insurance. And it's not clear that Bernie Sanders would be capable of spearheading this, given his tenure on the VA where he only solved the problems through a privatizing measure. Continuing Obama's work in expanding Medicaid into a real public option, providing a serious public counterbalance to the rent seeking from providers and pharmaceutical companies, is already a promising strategy. It certainly is a way to improve things from where they are now. You aren't some kind of political genius if you observe there's trouble with American healthcare. There has been political ink spilled on the issue for decades. The only real disagreement pertains to how the problem can and should be solved. Nobody has a monopoly on the right ideas, though it might be the right idea to look at the rest of the world, as it actually exists, for examples.